to the big development, the war of words that has erupted between the central government and the opposition over the Ayushman Bharat scheme. When Prime Minister Narendra Modi took a jibe at the Delhi and the West Bengal governments and said that the two governments are not implementing the scheme due to political self-interest, it was the former Delhi Chief Minister and Aam Aadmi Party National Convener Arvind Kejriwal who hit back at the Prime Minister, accused him of playing politics over the issue of public health in Delhi. He said that the Prime Minister was criticizing Delhi and West Bengal governments for failing to implement the Ayushman Bharat scheme insurance out of political interest. The TMC has, on the other hand, claimed that Ayushman Bharat scheme has stringent and restrictive eligibility criteria. The same argument that has been put forth by Aam Aadmi Party. The Swasthya Sathi initiative, which was introduced by the TMC, is an inclusive healthcare coverage, and this is what the claim of the Trinamool Congress is. The Trinamool Congress has said that the state government scheme of Swasthya Sathi has been more reliable. It is as compared to the BJP's quote-unquote bogus schemes of Ayushman Bharat. Let's start this conversation. On the telecast with me is Jasmine Sandawalia. She is the BJP spokesperson. Jasmine, how do you react to the Aam Aadmi Party and the West Bengal government, the TMC government's allegations that the Ayushman Bharat scheme is restrictive? It does not bring about benefits to all the people who need to get benefit. It is only on paper that the work and the benefits and the reach of Ayushman Bharat scheme is visible, and in contrast, the state government schemes that have been launched by Aam Aadmi Party and the TMC in Delhi and in West Bengal are working better for the people of these two states.
Banerjee are actually, well, you muted. Unfortunately, Mamata Banerjee and Mr. Kejriwal are indulging in one-manship up, and it is for everybody to see that it is their petty politics which is miring them to say something like this, because people who are above 70 and our senior citizens are being deprived of good health care, and senior citizens do constitute a large part of the population in our country. And to say that the state policies of health are better than the national policy is not only wrong, but is also a very corrupt practice by both astute politicians who are denying the citizenry of basic human health care rights. And in the BJP, we are very, very disappointed with this kind of corrupt politics, and we do not condone what they're saying. It is totally a blatant lie.
Okay, but okay, all right. The BJP says it's a blatant lie. Let's also get in other panelists into the discussion. I also have with me the Aam Aadmi Party. We also have with me the TMC government spokespersons over here. Let's start off with Nishant Anand, spokesperson of the Aam Aadmi Party. Nishant, how do you react to what the BJP has said? And of course, the targeted attack taken by the Prime Minister said, you know, the Delhi government and the West Bengal government that are being ruled by Aam Aadmi Party and the TMC respectively are working in self-interest. The Prime Minister has said that simply because they are sitting in the opposition, they refuse to implement the scheme that is going to be beneficial for the people of these two states.
Good afternoon to everybody. I will explain this in 7 points majorly. The Ayushman scheme is described as a significant fraud, claiming that the BJP has enriched itself by showcasing fake patients, and we have the report of it. Second point is, this scheme has limited benefits. This is only for a free treatment of 5 lakh rupees, and medications are free only when patients are hospitalized, and there is no facility for OPD. Point number 3, it is a failed program because many patients in UP, from UP, it has come to Delhi to get their treatment done. Fourth point is income restrictions. The people who are making more than 1,80,000 rupees are not eligible for this. So the people who have a television or a refrigerator in their house, they are not. This scheme is not valid for them. Now, the comparison from Delhi government scheme, it I have written a point. The Delhi government health scheme does not have any. We do not have any health restrictions. We do not have any funds, income restrictions. First of all, this is for everybody in Delhi. The scheme we have from Aam Aadmi Party. Now the central government mandates the only one scheme can be mandatory and operational in Delhi. So it has to be either Aam Aadmi Party scheme or this fraud scheme which has been launched by the BJP,
Okay.
which is not
So are
even
you at this?
successful
I mean,
in
is
UP.
the Aam Aadmi Party agreeing that they have halted the Ayushman Bharat scheme? They are not implementing. You are not implementing the Ayushman Bharat scheme in Delhi.
No, we need to understand the scheme should be the scheme should be beneficial for everybody.
No, I'm saying
living
whether
in Delhi.
whether it is beneficial or not. Is the Aam Aadmi Party government not implementing the Ayushman Bharat scheme in Delhi?
No, we are implementing the scheme which has been started by Aam Aadmi Party, which everybody has taken.
But then,
the
is there a
benefit.
possibility? I mean, fine. That's fine. If you are running the Delhi model in Delhi, that's good for you. That's good for the government. That is good for the people who are benefiting from it. Why is there then, hesitancy on the part of the Aam Aadmi Party government to parallelly allow for the implementation of Ayushman Bharat? How does this impact you?
Okay, I'll tell you. See, as per the central government, only one scheme can be mandatory in a state. Two schemes cannot work together. Second, I have told you 5 points which are negative for this scheme. People from UP, where this scheme is active by BJP, people are coming to New Delhi to get their treatment done. I believe BJP should implement the Aam Aadmi Party scheme, Mohalla clinics, in the nation so that everybody who is making less than 1,80,000 or more than that, they can also get the benefit of
Okay, how is
OPD
okay? Fair
and the
enough.
treatment.
Fair
I
enough.
want to say
Also,
something.
I'll come back to you, ma'am. Also, a question that arises in my mind is now yesterday Prime Minister spoke about how the scheme is now going to be expanded, and there are individuals, beneficiaries who are above the age of 70 will receive the benefits. They will be getting an annual sum of 5 lakh worth of medical facilities, whether it is medicines, whether it is operations, surgeries to be done, and it is applicable irrespective of the income that a family earns. How do you have to react to this? Does a Delhi model have something similar to the scheme that has now been launched by the Prime Minister yesterday? And if there is, then what is it? The question is for Nishant.
Sorry. See, as I mentioned, the Aam Aadmi Party scheme is valid for everybody in Delhi state. People are making less than 1,80,000 or more than that. The scheme given by BJP is only valid for the people who are making less than 1,80,000 rupees. Plus, it does not give medication to the patients. The people who are admitted can only get the benefit of medicine. So,
but the Prime Minister has said yesterday, the people who are above the age of 70 years, whether it is about medicines or about visits to the hospital or the clinics, or for that matter surgeries being done, they will be provided benefits to the tune of 5 lakh rupees on an annual basis, and whether you have television or not, whether you have a refrigerator or not, whether your income is above a certain point or not, it does not matter, you will get the scheme.
Okay, so the answer for that is the eligibility criteria for a scheme should be mandatory for everybody. This scheme has so many complications that 99% of people in Delhi would not be able to take the benefit. This scheme that we have in Aam Aadmi Party is valid for everybody, not only for the people
I was asking you a certain question. You have again not deflected from it, but I'm going to ask you, Nishant, what is the Delhi model for the people who are, as you say, are benefiting from the medical scheme? If you could just give us, specifically those 5 points.
Okay, so first of all, Delhi scheme is, if you talk about Mohalla clinic, people get medicines without they are in OPD or not. They get the medication if it's been subscribed. Plus, anybody's treatment, if it is for 50,000 rupees or 50 lakh rupees, it has been given by the Delhi government. Anybody, if somebody is not getting a bed or an OPD in a government hospital, and if they go to a private hospital, Delhi government takes care of it. We need to understand a scheme which is already running and people are taking the benefit. BJP should accept it and should implement this scheme all over in other states.
Okay,
also.
so then is
When
there
people
any
from-
demarcation? Is there at this point in time an eligibility criteria, or any person, whether they are middle class, upper middle class, rich, lower middle class, poor, everybody, every single person is entitled to take benefit of this scheme?
Everybody who requires a treatment or a medicine, requires the help from the mohalla clinic, it is eligible for everybody. Now we need to
Okay, so that's it. Yes or no? Are you saying that the rich, the upper middle class, lower middle class, poor, are they all eligible for the scheme?
Ma'am, I'm sure you understand, rich and upper class is not coming to any government schemes, but it is applicable and given to everybody. The answer is it is given and it is there for everybody.
And that's what I'm
to
saying.
utilize it.
That's exactly what I'm saying. What is the eligibility for an individual or a family to avail the scheme that the Delhi government has rolled out? That's what I want. I want to understand what is the demarcation.
Everybody who requires a treatment, a doctor, a medicine, they can visit under the Delhi scheme.
Is there a certain income criteria? Because you say it is not valid for the rich or the upper middle class or the middle class.
Okay, it is not valid for 1,80,000 income as it is in Ayushman scheme. It is given to everybody who requires a benefit. We do not differentiate.
I'm not getting an answer from you over there. I also have with me Anubrata Roy. He is a TMC supporter. Anubrata, let's hear it from you. Now, the claims that are being made by the TMC that the scheme is restrictive, the same points that have been raised by the Aam Aadmi Party as well. How do you justify that your scheme is better than Ayushman Bharat?
In every way, our scheme, the Swasthya Sathi scheme, we call it, is better than Ayushman Bharat, because our scheme was introduced far ahead. It was introduced in like later 2016, something like that. If I'm not very wrong, I have to tell you a story. It's a real story. During the elections of 2021, Dilip Ghosh and his family went on a Duare Sarkar campaign, camp, and got themselves a Swasthya Sathi card, which the smart card we give every whoever is applicable to the scheme. So, and another BJP MP, Jyotirmoy Singh Mahato, and his brother got the same card, Swasthya Sathi card, which was introduced by the Trinamool government. It really disregards the credibility of Ayushman Bharat when their own MPs and netas don't really care about the scheme. And I really don't know how Mr. Modi, our Prime Minister Modi, is really creating this as very the availability of the scheme. It is very humorous. I don't know why he is saying that it is very available to all. Like
I'm just like the same question I asked to the Aam Aadmi Party spokesperson. I would again like to ask you as well as the TMC spokesperson over here. Is there an eligibility criteria for an individual or a family to avail this scheme? Again the same question. Are all the communities, whether they are from the richest strata, the upper middle class, the lower middle class, are they all eligible for this scheme that has been launched by the TMC government?
Whoever is a permanent resident of West Bengal or living in West Bengal is applicable to this scheme. There is no boundaries, because I have personally seen someone who has a Volkswagen Polo have gone to a Duare Sarkar camp and got the card. So it's very available, no one is barred from here. 5 lakhs flat. You can take whatever you want from the 5 lakhs for medical purposes. No one is barred from that. No one.
Okay. Alok Mehta, let's hear it from you now. Do you think these are vested interest by the central government and the state governments, particularly in West Bengal and in Delhi, that this bickering continues? Now, Delhi is going to see elections taking place in 2025 unless there is a trust vote that is passed. There had been a lot of speculations that were being arisen because the Aam Aadmi Party and Arvind Kejriwal were saying that they would once again want to go, snap elections to take place, because according to them, they want to once again reinstate the confidence of the people in the Aam Aadmi Party. Do you think this is just political motive that is causing the central government and the state governments to again bicker, and this time around it is Ayushman Bharat scheme?
As far as I am concerned with
this is for Alok Mehta. The question is for Alok Mehta.
Okay, I'm sorry.
Megha, frankly speaking, the health and education is a state subject because of the constitutional provision. Earlier also, even before Aam Aadmi Party or even Trinamool Congress appeared in the politics, at that time also the government hospitals were supposed to give all facilities to every citizen. This is and then in the earlier years also there was a right to health. Yesterday, Prime Minister Narendra Modi ji spoke about the scheme of Ayushman Bharat for 70 years and above people, the old people, because crores, 5 to 10 crores people in this group. Then everybody will be benefited by this scheme, even if you are rich, poor, middle class, upper class, whatever. One point is. That's why I'm saying. And about the Ayushman Bharat, I'm not here for the political debate because somebody should be from BJP should be there, what he will speak to you, and the BJP is already there. So what I'm telling you, very unfortunate. Mr. Anil Swarup, when he was the Labour Secretary, he started one scheme long back when the Congress government was there, 2009. Then 30,000 rupees per labourer. And at that time, the BJP ruled government, it's on record, I've written those days in the column. BJP ruled government implemented very well this scheme. And poorest was in Delhi when even the Congress party, Sheila Dikshit had a lot of respect for her. But implementation in the Manmohan Singh regime also not implemented very well. Ayushman Bharat then come to this because the same person, Anil Swarup was also in the meeting when Ayushman Bharat discussed. Even the central government also discussed when the Mohalla clinic proposal came for the central government too. When JP Nadda ji was the president and Mr. C.K. Mishra was the secretary. At the time, I spoke to C.K. Mishra ji. C.K. Mishra ji, I know him when he was in Bihar also. So he told me that this kind of scheme for lower, like a primary medical center. Unfortunately, the Mohalla clinic is I should not go in the politics, but it's nothing because even nobody knows. Even if you go, Chokidar and come in Mayur, I'm living in East Delhi, come and anybody who can say, okay, where is they, what they will get, or even I know the people, I have the numbers. That's why yesterday I tweeted, poor people, woman went to a hospital for her husband, then they charged in the Delhi government hospital 45,000 rupees, and even for medicine after the operations, they said, okay, 500 rupees you give, then we will give you the medicine. These kind of rackets was going on. In Mohalla clinic, they just say, okay, go for checkup this, because they have some own laboratories, commissions, they get doctors, 50,000 rupees paid, but I know one doctor who was paid 50,000 rupees a month. He visit just 2 or 3 days, go for 2-3 hours. So Mohalla clinic is just a show, but to show in a World Bank, you show the United Nations, somebody ambassador, this kind of propaganda is there. Otherwise, the Ayushman Bharat for labor coming from Bihar, from UP, from Bengal, from Kerala, anybody will. And what they want help from government hospitals, and especially the Ayushman Bharat. They are entitled. If they go to Ghaziabad, if they belong to Ghaziabad, they get everything. In Haryana, they get everything. In Karnataka, they get everything. In Tamil Nadu, Ayushman Bharat is most successful. Do you think they are pro-BJP, Tamil Nadu government? I think this is the ridiculous, because this is the politics. Maybe because the new scheme started yesterday, Prime Minister, that's why I am raising since long about this. I'm writing about it. This Ayushman Bharat scheme is good for the poor people, whatever they get, and then somebody else can. Otherwise, government hospitals are supposed to give facilities. But this scheme, 5 lakh rupees, is good for any operations, for any accident. These kind of schemes should be implemented everywhere.
Okay.
And that's why nowhere in the world it happened that the state government say, okay, either you have insurance also say if you are admitted, then you get the facility. Ayushman Bharat says if you go, you have a card, then you can get facilities. And for 70-year-old people, even if they depend on children, it's good for them. At least they will not depend on the children. They have to earn and give the money to them.
Okay.
So they should have welcomed. I'd be very unfortunate. Yesterday I said it's a mahapap. What they are opposing for poor people of this above the 70-year-old.
Okay. Jasmine, coming to you, and this is. Do you think this is a legitimate argument that because of the income restrictions, because of other restrictions, eligibility criteria, you need to have, if you have a television set or a refrigerator, you will not be able to avail the scheme. How does BJP justify that, or do you think there needs to be some modification made in the Ayushman Bharat scheme so that more people can be added and can take benefit of this scheme?
Megha, just yesterday the Prime Minister has announced that people above 70 years will be entitled to this Ayushman scheme, which gives them 5 lakhs. And we all know that medical treatment is so expensive. And when we've made a criteria that poor people will be I should not say poor people, the disadvantaged Indian citizenry should be entitled to world-class healthcare. And if you go for any surgery, it is so expensive. And even in the civil hospitals, it is very difficult for them to get open heart surgery, or there's any other major surgery. The BJP has come up with this flagship scheme, insurance, kind of a health insurance for the needy. And collectively, we have always modified, catering to the growing needs of the senior citizenry and the younger lot also. And it is very unfortunate when the states are playing politics on such a scheme, because any chief minister should feel very happy if his citizens are going to benefit in West Bengal or in Delhi. The people would be very happy, and I think the citizenry of Delhi and West Bengal would put Mamata Banerjee and Kejriwal up on a moral high ground if they welcome something which was coming from the center. It is unfortunate that politics is being played on something so small. And last point I want to say is that, like Mr. Lok Mehta said, the Mohalla clinics are nothing but a sham which are being carried on, and the doctors there are catering to flu or to minor cold or to my headache. No surgeries are being done in Mohalla clinics. No major medical issues are being readdressed, and I rest my case on this. That is entirely sad what Kejriwal is doing.
Anubrata, before I go to Anubrata, Nishant, what you would like to say, and particularly, do you think the Kerala governments and the Tamil Nadu government, which are being run by opposition parties, are at this point of time, are their state government schemes not good enough, and therefore they are accepting of the Ayushman Bharat scheme?
See, I am here to tell about Aam Aadmi Party. BJP spokesperson just said the Mohalla clinic, which is a dummy. I want to tell them that 3 times Delhi people have selected and mandatory we got Aam Aadmi Party, because the Mohalla clinic and all the policies that Aam Aadmi Party has mentioned has been executed, and people are taking the benefit of it. In the last 3 elections, we have got the maximum seats because of the work and the benefit people are getting it. This scheme is only available people who are above 70. Last point, they have done crores of rupees of fraud by showing fake patients in different states where this scheme is already valid. And as I said, neighboring states, people are coming to Delhi to get the benefit from the Aam Aadmi Party scheme. And this time also people will tell them when the elections will happen how many Mohalla clinics are running. That is why in Punjab also this has been successful, and we have formed a government there. The only reason we need to understand is Aam Aadmi Party has been doing the best for the citizens of Delhi.
Anubrata, what would you like to say? Do you think the other opposition parties who are accepting of the Ayushman Bharat scheme, you think that they have accepted, they recognize that their state policies are not as good as Ayushman Bharat versus the Delhi model and the Bengal model? You feel that your schemes are superior to the central government Ayushman Bharat scheme?
As far as I'm concerned about Bengal, it is of course superior, because only the opposition leaders and all of them have been praising the Swasthya Sathi card. Those who are following Bengal politics for a while, they know how Swasthya Sathi card has been revolutionary. It is the mainstream and the medical treatment card in West Bengal. Because Ayushman Bharat has been, if I am not wrong, very much wrong, 40% of the funding has been done by the West Bengal government in its state. So the state have a say about the Ayushman Bharat practices. So I really don't know why are we getting attacked for being for raising our concerns about this Ayushman Bharat. I'm not saying that Ayushman Bharat is the total bogus. No, we have a certain rights of funding over there. But if the practice is not done correctly, why would the state government won't question about it? The eligibility is not at all transparent.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.